over the last, I'd say especially 10 years, but even before, so Dr. Tamil out of MGH published a study in the New England Journal of Medicine with early incorporation of palliative care, and really just showed that outcomes were across the board better. People did better as far as symptoms, people lived longer, which was the aspect of that was less intuitive to me. So across the board did better, which really kind of kickstarted this early incorporation of palliative care. Now that being said, maybe the first, before even diving further into that, is what is palliative care? Because people have such different ideas around that. Some people have heard of palliative care only associated with hospice, and so they think of palliative care as end-of-life care. And palliative care certainly is often involved in end-of-life care, but that's not all. And so I will often, when discussing this with individuals, if the word palliative care, I can see the room start spinning around them, as I'll say, we also could call it supportive oncology. And supportive oncology, it kind of communicates more that this is, another part of the team in your treatment. And so palliative care can help a lot with symptom control. And sometimes, they can also help people kind of get their feet on the ground a little more too. I'll say one of the things that drove me into oncology is I don't think that there's another field in medicine that incorporates or kind of pulls in the whole person as much as oncology. It is not just the body and the disease, but the mind and emotions and all of this. And so often when people are diagnosed, I can see during their office visit, the room is just spinning around them. And one of the things I really focus on is how to help people kind of get their feet on the ground enough that we can talk about it in a more tangible way. And I think palliative care can help with some of that as well. I see from the patient experience, just in what I'm observing in people when they come in, oftentimes the discussion with the medical oncologist, the discussion will be a little different than when talking with other team members. I think often with nurses, patients tend to be a bit more explicit about their experiences. They'll discuss the side effects a bit more. Often with the oncologist, I see individuals not wanting the doctor to hold back or wanting to make sure they're getting everything. So they say, everything's fine, just keep it up. And so having these different team members that can kind of interact with the patients and the different aspects of their truth of what they're going through and put those pieces together to really treat that individual the best can be extremely valuable. Hopefully that's all making sense, because this is kind of an intangible topic, but there's mention sometimes that doctors they kind of talk over patients, and there's this idea out there. And I think we all experience life in an emotional way, especially with something as big as cancer. That's a very emotional experience. And so when you get the doctors coming in and just kind of talking the intellectual or talking the facts or the objective, sometimes those don't quite connect. And so these other team members that can kind of incorporate the whole experience and then have a shared coordinated group care can be extremely valuable. So palliative care engages more on this as well, but also any symptoms that you're experiencing. So things like nausea, if that is more of a problem, things like pain, if that is a problem, other types of symptoms, they'll be very focused on some of those and can often add to that. I do not tend to involve palliative care for all patients, but I think in somebody who's having symptoms, I am more attentive to the idea that it might not be as well controlled as I think, and if I have any hint that there's maybe something more that could be added within that, then I'll incorporate palliative care in those cases.